Question 1. A patient is seen in the outpatient clinic for routine follow-up of type 2 diabetes mellitus with diabetic neuropathy. What is the correct sequencing of diagnosis codes? A. G63, E11.40. B. E11.40, G63. C. E11.9, G63. D. G60.0, E11.40. Answer: B. E11.40, G63. This question tests understanding of coding conventions for combination codes in ICD-10-CM, specifically regarding diabetes with complications. The keyword routine follow-up and the mention of both type 2 diabetes mellitus and diabetic neuropathy indicate a single code should capture both conditions if available. ICD-10-CM guidelines state that when a combination code exists for a condition and its associated manifestation or complication, that single code should be used. E11.40 is the combination code for type 2 diabetes mellitus with diabetic neuropathy, which should be sequenced first as the primary reason for the encounter, followed by any additional codes for conditions not included in the combination code if applicable. For example, if the patient had an additional unrelated condition, it would be coded separately and sequenced after the primary diagnosis. Remember, always look for combination codes first to capture the full relationship between conditions. Question 2. A 55-year-old male presents to the physician's office with new-onset chest pain. The physician takes a detailed history, performs an extended exam of the cardiovascular and respiratory systems, and makes decisions of moderate complexity regarding his care, including ordering an ECG and blood tests. What is the appropriate E/M code for this service? A. 99203. B. 99204. C. 99213. D. 99214. Answer: B. 99204. This question assesses knowledge of E/M coding for new patients in the office or other outpatient setting, focusing on the 2021 E/M guideline changes. The keywords new-onset chest pain and new patient are crucial. For new patient E/M services, the code selection is now based on either the medical decision-making, MDM, level or the total time spent. With detailed history, extended exam, and decisions of moderate complexity, the MDM level points to a 99204 for a new patient. For instance, a new patient encounter with moderate MDM typically involves an acute illness with systemic symptoms or two or more stable chronic illnesses. Always consider if the patient is new or established first, then evaluate the MDM or total time to select the correct E/M code. Question 3. A surgeon performs an open excision of a tumor from the right lower lung lobe. The entire lobe is removed. In ICD-10-PCS, which root operation best describes the removal of the entire lung lobe? A. Excision. B. Resection. C. Extraction. D. Destruction. Answer: B. Resection. This question tests understanding of ICD-10-PCS root operations, specifically distinguishing between excision and resection. The keyword entire lobe is removed is the critical clue. Resection involves the cutting out or off, without replacement, of all of a body part or all of a segment of a body part. Excision, on the other hand, means cutting out or off, without replacement, a portion of a body part. Removing an entire lung lobe qualifies as removing all of a segment of a body part, making resection the appropriate root operation. For example, removing an entire kidney would also be coded as resection, while taking a small biopsy from the kidney would be an excision. When considering removal, ask yourself if the entire body part or segment is gone to determine if it's a resection. Question 4. Which of the following is considered a potential consequence of healthcare fraud and abuse for a healthcare organization? A. Improved patient satisfaction scores. B. Increased reimbursement rates. C. Exclusion from federal healthcare programs. D. Enhanced public reputation. Answer: C. Exclusion from federal healthcare programs. This question assesses knowledge of the serious repercussions of healthcare fraud and abuse. The concept being tested is the regulatory penalties imposed on providers or organizations found guilty of such offenses. The keyword consequence directs you to look for a negative outcome. Exclusion from federal healthcare programs, such as Medicare and Medicaid, means the organization or individual can no longer bill for services provided to beneficiaries of these programs, which can effectively shut down a practice or severely impact a hospital's revenue. For example, an organization found to be routinely billing for services not rendered could face significant financial penalties and be barred from participating in these essential government programs. Always remember that compliance is not just about avoiding fines, it's about maintaining the privilege to participate in the healthcare system. Question 5. A patient is admitted to the hospital with acute exacerbation of chronic obstructive pulmonary disease, COPD, and also has congestive heart failure, CHF, and hypertension. Which condition should be coded as the principal diagnosis? A. Congestive heart failure. B. Hypertension. C. Acute exacerbation of chronic obstructive pulmonary disease. D. Both COPD and CHF. Answer: C. Acute exacerbation of chronic obstructive pulmonary disease. This question tests the application of inpatient principal diagnosis guidelines, particularly the reason for admission rule. The keywords admitted to the hospital and acute exacerbation of chronic obstructive pulmonary disease clearly indicate the primary reason the patient required inpatient care. The principal diagnosis is defined as the condition established after study to be chiefly responsible for occasioning the admission of the patient to the hospital. While the patient has other chronic conditions like CHF and hypertension, the acute exacerbation of COPD is what directly led to the hospital admission and will be the focus of the inpatient care. For instance, if a patient is admitted for a broken leg but also has diabetes, the broken leg is the principal diagnosis because it caused the admission. Always select the condition that led to the inpatient admission as the principal diagnosis. Question 6. A patient receives a prescribed durable medical equipment, DME, item, specifically a standard manual wheelchair, for long-term use at home. Which code set is used to report this item for billing purposes? A. CPT. B. ICD-10-CM. C. HCPCS Level 2. D. ICD-10-PCS. Answer: C. HCPCS Level 2. This question examines the appropriate use of different code sets for billing healthcare services and supplies. The keyword durable medical equipment, DME, is the crucial indicator. HCPCS Level 2 codes are used to report medical supplies, durable medical equipment, injectable drugs, transportation services, and other items and services not covered by CPT. CPT codes are for physician procedures and services, ICD-10-CM for diagnoses, and ICD-10-PCS for inpatient procedures. For example, if a patient needs crutches or a blood glucose monitor, these would also be reported using HCPCS Level 2 codes. Remember that HCPCS Level 2 fills the gap for items and services not found in CPT, ensuring comprehensive billing. Question 7. A 35-year-old female presents for her annual physical examination with no current health complaints. What is the appropriate ICD-10-CM code for this encounter? A. Z00.00. B. Z00.01, C, Z01.419, D, Z00.129. Answer A, Z00.00. This question tests the correct use of Z codes in ICD-10-CM for encounters related to examinations. The keywords annual physical examination and no current health complaints are essential clues. Z00.00 is the correct code for an encounter for general adult medical examination without abnormal findings. Z00.01 would be used if there were abnormal findings. Z codes are important because they explain the reason for an encounter when a patient is not necessarily ill but is receiving healthcare services like screenings or vaccinations. For example, if a child receives a routine well-child check, a Z code describing the health supervision encounter would be used. Always choose the most specific Z code that accurately describes the reason for the visit. Question 8. A surgeon performs an extensive wound debridement in the operating room. The procedure involves debridement of skin, subcutaneous tissue, and muscle. Which CPT modifier would typically be appended to indicate that the debridement was performed on the left side of the body? A, -50, B, LT, C, RT, D, -51. Answer B, LT. This question assesses knowledge of CPT modifiers, specifically those indicating laterality. The keyword left side of the body directly points to the need for a laterality modifier. The LT modifier signifies that the procedure was performed on the left side of a paired organ or anatomical site. Similarly, RT is used for the right side. The -50 modifier is for bilateral procedures, and -51 is for multiple procedures. For instance, if the same debridement was performed on the right side, the RT modifier would be used. Using the correct laterality modifier is crucial for accurate billing and to prevent claim denials by clearly indicating the anatomical site of the service. Question 9. In the hospital inpatient setting, what is the primary purpose of the Medicare Severity Diagnosis-Related Group, MS-DRG, system? A. To determine physician payment for outpatient services. B. To classify inpatient hospital stays for reimbursement purposes. C. To categorize diagnoses for epidemiological tracking. D. To manage prescription drug benefits. Answer B. To classify inpatient hospital stays for reimbursement purposes. This question tests the fundamental understanding of inpatient payment methodologies, specifically MS-DRGs. The keyword hospital inpatient setting and reimbursement are key indicators. MS-DRGs are a classification system that groups patients with similar diagnoses, procedures, and resource utilization into categories, upon which Medicare bases its payment to hospitals for inpatient stays. They are not used for outpatient services, physician payments, or drug benefits. For example, a patient admitted for pneumonia will be assigned an MS-DRG that reflects the average resources used to treat that condition, allowing for a standardized payment regardless of the length of stay or specific treatments within the DRG's scope. Remember, MS-DRGs are the cornerstone of inpatient hospital reimbursement under Medicare. Question 10. A patient undergoes an open procedure where the physician accesses the mediastinum to remove a foreign body from the esophagus. In ICD-10-PCS, which body system would be assigned for the esophagus? A. Gastrointestinal system. B. Respiratory system. C. Hemic and lymphatic system. D. Mediastinum. Answer A. Gastrointestinal system. This question assesses understanding of ICD-10-PCS body system assignments. The keyword esophagus is the key to identifying the correct body system. Even though the approach was through the mediastinum, the body part on which the procedure was performed, the esophagus, belongs to the gastrointestinal system according to the ICD-10-PCS tables. The body system is determined by the body part that is the focus of the procedure, not necessarily the anatomical approach or the surrounding structures. For example, a procedure on the stomach would also fall under the gastrointestinal system, regardless of the surgical approach. Always focus on the body part involved in the procedure to determine the correct body system in ICD-10-PCS. Question 11. A patient presents with a fractured tibia. The orthopedic surgeon performs an open reduction with internal fixation. What type of CPT code would primarily be reported for this surgical procedure? A. Evaluation and Management, E/M, code. B. Radiology code. C. Surgery code. D. Medicine code. Answer: C. Surgery code. This question tests the basic classification of CPT codes and their application to different types of services. The keywords fractured tibia, open reduction, and internal fixation all point to a surgical intervention. CPT codes are organized into main sections, with the surgery section encompassing a vast range of procedures from integumentary to musculoskeletal systems. E/M codes are for office visits, hospital visits, etc., radiology codes for imaging services, and medicine codes for non-surgical therapeutic services like immunizations. For example, a tonsillectomy or an appendectomy would also be reported with CPT codes from the surgery section. Remember, any invasive procedure involving incision, excision, repair, or manipulation is typically found in the surgery section of CPT. Question 12. A patient is diagnosed with both chronic kidney disease, CKD, stage 3, and hypertension. According to ICD-10-CM guidelines, how should these conditions be coded when they are linked by documentation? A. Code CKD only, as hypertension is a common comorbidity. B. Code hypertension first, followed by CKD. C. Code CKD first, followed by hypertension. D. Code both conditions with a combination code if available, or code hypertension as primary with CKD as secondary. Answer: D. Code both conditions with a combination code if available, or code hypertension as primary with CKD as secondary. This question addresses the specific ICD-10-CM guideline for coding hypertension with chronic kidney disease. The keyword linked by documentation is crucial, as it indicates a cause and effect relationship. ICD-10-CM guidelines state that when hypertension and CKD are both present, and the documentation indicates a relationship, a combination code from category I-12, hypertensive chronic kidney disease, should be used if the type of hypertension is specified as hypertensive and the CKD stage is known. If a combination code is not applicable, hypertension, I-10-I-15, is sequenced first, followed by the appropriate CKD code, N18. For instance, if the patient has hypertensive chronic kidney disease stage 3, the code would be I-12.9, hypertensive chronic kidney disease with stage 3 chronic kidney disease. Always refer to specific disease guidelines in ICD-10-CM for proper sequencing and combination code use. Question 13. Which government agency is primarily responsible for combating fraud and abuse in Medicare and Medicaid programs? A. Centers for Medicare and Medicaid Services, CMS. B. Office of Inspector General, OIG. C. American Medical Association, AMA. D. National Committee for Quality Assurance, NCQA. Answer: B. Office of Inspector General, OIG. This question tests knowledge of key regulatory bodies in healthcare, specifically those fighting fraud and abuse. The keywords combating fraud and abuse and Medicare and Medicaid programs point directly to the OIG. The OIG is a federal agency within the Department of Health and Human Services, HHS, that protects the integrity of HHS programs, including Medicare and Medicaid, by detecting and preventing waste, fraud, and abuse. While CMS administers the programs, the OIG is the enforcement arm regarding fraud. For example, the OIG publishes work plans outlining its enforcement priorities and issues advisory opinions on compliance matters. Understanding the OIG's role is critical for maintaining compliance in a healthcare organization. Question 14. A patient undergoes an MRI of the brain without contrast. What component is typically included in the CPT code for this diagnostic imaging service? A. Interpretation and report by the radiologist. B. Prescription of medication based on findings. C. Patient transportation to the imaging center. D. Follow-up consultation with the ordering physician. Answer: A. Interpretation and report by the radiologist. This question focuses on the components typically bundled into CPT codes for diagnostic imaging services. The keyword MRI of the brain without contrast signifies a professional component of a radiology service. Diagnostic imaging codes, such as those for MRI or X-ray, typically include both a technical component, the actual performance of the imaging and equipment, and a professional component, the radiologist's interpretation of the images and creation of a formal report. They do not include subsequent medical management or logistics. For instance, when a chest X-ray is performed, the CPT code covers the image acquisition and the radiologist's reading of that image. Always remember that diagnostic service codes generally encompass the work of both performing and interpreting the test. Question 15. A patient presents to the emergency department after being bitten by a stray dog. In ICD-10-CM, which type of additional code would be used to describe the circumstances of the injury? A. Z code. B. External cause code. C. Status code. D. History code. Answer: B. External cause code. This question assesses the use of external cause codes in ICD-10-CM. The keywords bitten by a stray dog and circumstances of the injury are key indicators. External cause codes, starting with V, W, X, or Y, are used to report the cause of injuries, poisonings, and other adverse effects, and they provide valuable statistical data on morbidity and mortality. They are secondary codes, never principal, and describe how the injury occurred, not the injury itself. For example, if a patient falls off a ladder, an external cause code would describe the fall from the ladder. Always consider external cause codes when coding injuries to fully describe the event. Question 16. During a laparoscopic cholecystectomy, the surgeon inserts instruments through small incisions in the abdominal wall to remove the gallbladder. In ICD-10-PCS, what is the approach used? A. Open. B. Percutaneous. C. Laparoscopic. D. Via natural or artificial opening endoscopic. Answer: D. Via natural or artificial opening endoscopic. This question tests understanding of ICD-10-PCS approaches, specifically for minimally invasive procedures. The keywords laparoscopic cholecystectomy and small incisions in the abdominal wall describe a procedure performed through a natural or artificial opening, but with the aid of an endoscope. In ICD-10-PCS, procedures performed via small incisions where the scope enters through the skin are classified as via natural or artificial opening endoscopic. Percutaneous typically refers to punctures without an endoscope, like needle biopsies. For example, an appendectomy performed through a small scope incision would also use this approach. Remember that laparoscopic in a procedure name often translates to via natural or artificial opening endoscopic in ICD-10-PCS. Question 17. A 6-month-old infant receives a routine DTaP vaccination. What CPT code section would this service be found in? A. Surgery. B. Radiology. C. Pathology and Laboratory. D. Medicine. Answer: D. Medicine. This question assesses the general organization of CPT code sections. The keyword vaccination is the primary clue. Vaccinations, along with therapeutic injections, infusions, psychiatric services, and other non-surgical procedures, are reported using codes from the medicine section of CPT. The other sections, surgery, radiology, and pathology/laboratory, are dedicated to their respective types of services. For example, an allergy injection or a therapeutic drug infusion would also be coded from the medicine section. Always remember that the medicine section covers a wide range of non-surgical, often recurring, therapeutic and diagnostic services. Question 18. The medical term hepatomegaly refers to the enlargement of which organ? A. Heart. B. Kidney. C. Liver. D. Spleen. Answer: C. Liver. This question tests basic medical terminology, specifically word roots. The keyword hepatomegaly can be broken down into hepato- and megaly. Hepato- is the combining form for liver, and megaly means enlargement. Therefore, hepatomegaly means enlargement of the liver. Understanding common medical prefixes, suffixes, and root words is fundamental for accurate medical coding, as it allows coders to interpret clinical documentation correctly. For example, nephrology refers to the study of the kidney because nephro- is the root for kidney. Dedicate time to mastering common medical terms, as it will make interpreting documentation much easier. Question 19. For hospital inpatient encounters, what does the present on admission, POA, indicator signify? A. If the condition was treated during the hospital stay. B. If the condition was present at the time the order for inpatient admission was written. C. If the condition developed during the hospital stay. D. If the condition was the principal diagnosis. Answer: B. If the condition was present at the time the order for inpatient admission was written. This question tests understanding of the present on admission, POA, indicator, a crucial concept for inpatient coding and quality reporting. The keywords present on admission and signify are direct clues. The POA indicator is assigned to each diagnosis code to identify whether the condition was present at the time the patient was admitted to the hospital, or if it developed during the inpatient stay. It impacts reimbursement and quality metrics, especially for hospital-acquired conditions, HACs. For example, if a patient develops a pressure ulcer after admission, the POA indicator for that condition would be N, not present on admission. Properly assigning POA indicators is vital for accurate data and avoiding penalties related to HACs. Question 20. A pathology report indicates that a breast biopsy specimen was sent for routine histopathological examination. Which CPT section would contain the code for this service? A. Surgery. B. Radiology. C. Pathology and Laboratory. D. Medicine. Answer: C. Pathology and Laboratory. This question assesses the organization of the CPT codebook sections. The keywords pathology report and histopathological examination clearly indicate a service performed by a pathologist in a laboratory setting. The pathology and laboratory section of CPT includes codes for services such as surgical pathology, chemistry tests, microbiology, and hematology. Surgery codes are for procedures, radiology codes for imaging, and medicine codes for non-surgical therapeutic services. For instance, a blood count or a urine test would also be found in the pathology and laboratory section. Remember, if a service involves analysis of specimens or fluids, it will almost certainly be coded from the pathology and laboratory section. Question 21. Which of the following describes the purpose of the National Correct Coding Initiative, NCCI, edits? A. To prevent payment for services that are not medically necessary. B. To promote correct coding and control improper coding leading to inappropriate payment for Medicare Part B claims. C. To establish reimbursement rates for inpatient hospital services. D. To identify fraudulent billing practices across all payers. Answer: B. To promote correct coding and control improper coding leading to inappropriate payment for Medicare Part B claims. This question tests the understanding of NCCI edits, a critical compliance tool. The keywords National Correct Coding Initiative and improper coding are direct pointers. NCCI edits are developed by CMS to prevent inappropriate payment for services that should not be reported together. They consist of procedure-to-procedure, PTP, edits and medically unlikely edits, MUEs. For example, NCCI edits might prevent payment for two procedures that are mutually exclusive or for a lesser procedure that is always bundled into a more comprehensive one. Understanding NCCI edits is crucial for professional coders to avoid claim denials and ensure compliant billing practices. Question 22. A patient experiences a painful neuroma after an amputation of the left leg due to a diabetic ulcer. In ICD-10-CM, how is the neuroma described in relation to the amputation? A. As a primary condition. B. As a sequelae. C. As an unrelated complication. D. As a principal diagnosis. Answer: B. As a sequelae. This question tests the concept of coding sequelae in ICD-10-CM. The keywords neuroma after an amputation indicate a condition that is a late effect or residual of a previous illness or injury. A sequelae is a condition that results from a previous illness or injury but does not manifest until after the acute phase of the original illness or injury has terminated. In this case, the neuroma is a direct consequence of the amputation, even though it appears later. For example, scar formation after a burn, or paralysis after a stroke, are also considered sequelae. When coding sequelae, the sequelae code is typically sequenced first, followed by the code for the cause of the sequelae, unless specific guidelines dictate otherwise. Question 23. Under the Outpatient Prospective Payment System, OPPS, what is the primary unit of payment for hospital outpatient services? A. MS-DRGs. B. RBRVs. C. APCs. D. Per diem rates. Answer: C. APCs. This question assesses knowledge of outpatient hospital payment methodologies. The keywords Outpatient Prospective Payment System, OPPS, and Hospital Outpatient Services are direct clues. Under OPPS, services are grouped into ambulatory payment classifications, APCs, and a fixed payment is made for each APC. MS-DRGs are for inpatient services, RBRVs, Resource-Based Relative Value Scale, is primarily for physician services, and per diem rates are typically older or facility-specific payment methods. For example, if a patient receives an outpatient chemotherapy infusion, the hospital is reimbursed based on the APC assigned to that specific service, which bundles all related costs. Remember that APCs are the backbone of reimbursement for most hospital outpatient services under Medicare. Question 24. A surgeon performs an open appendectomy. What does the global surgical package for this procedure typically include? A. Only the intraoperative service of the surgeon. B. Preoperative visits, the intraoperative service, and routine postoperative care. C. Anesthesia services and facility fees. D. All services provided by any physician during the entire hospital stay. Answer: B. Preoperative visits, the intraoperative service, and routine postoperative care. This question tests understanding of the global surgical package concept in CPT and Medicare payment. The keywords global surgical package and appendectomy refer to a comprehensive payment model for surgical procedures. The global surgical package includes the surgery itself, intraoperative service, necessary preoperative visits, e.g., day before or day of surgery, and routine, uncomplicated postoperative care in the hospital and office for a specified period, e.g., 90 days for major surgeries. It does not include anesthesia, facility fees, or services by other physicians unless directly related to the same global period and specific to the surgeon's responsibility. For example, if a patient develops an unrelated illness during the postoperative period, that would be coded and billed separately with an appropriate modifier. Always remember that the global period bundles services related to the surgery to streamline billing and payment. Question 25. A patient's medical record documents pneumonia. When coding this diagnosis in ICD-10-CM, which term should be located first in the alphabetic index? A. Acute. B. Lobe. C. Pneumonia. D. Bacterial. Answer: C. Pneumonia. This question tests the fundamental process of locating codes in the ICD-10-CM alphabetic index. The keyword pneumonia is the core medical condition. When using the alphabetic index, one should always locate the main term first, which typically identifies the disease, condition, or injury. Modifiers like acute, lobe, or bacterial are found as subterms under the main term. For example, if a patient has hypertensive heart disease, you would look up disease, heart, hypertensive as the main term, not hypertensive. Always start your search with the condition itself to efficiently navigate the alphabetic index.